The surgical suite fell silent as Dr. Rachel West froze, forceps suspended midair, her eyes widening with disbelief. What she had extracted from Margaret Harrison's back wasn't a typical melanoma, it was something else entirely. "Oh my God!" Nurse Patterson whispered, then screamed, stumbling backward until she hit the instrument tray, sending metal clattering across the floor. Through the observation window, William Harrison pressed his weathered hands against the glass, his wedding ring catching the harsh fluorescent light. He'd known something was wrong with that mole for years, but never this. Never something that could make a veteran nurse of 30 years scream in horror. "Get Dr. Bennett in here now," Dr. West commanded, her voice steady despite the trembling of her hands. What had been growing inside Margaret's back for 15 years since Iraq? And more importantly, was it too late? Leave a like and share your thoughts in the comments along with the city you're watching from now. Let's continue with the story. Margaret and William Harrison had built their life together in the small lakeside town of Pinecrest, Michigan, where the changing seasons marked the passing of their 46 years of marriage. Their modest two-story home sat 3 blocks from Lake Michigan, close enough to hear the waves on stormy nights, but far enough to afford their fixed-income retirement. The blue shutters needed painting, and the porch steps had begun to sag, but it was theirs, paid off after decades of careful saving. Margaret had never been one to complain. Not during her tour as a trauma surgeon with the Medical Corps in Iraq, not during 30 years of practicing surgery at Pinecrest Community Hospital, and certainly not about her health. At 65, she stood as straight as she had at 25, her broad shoulders only slightly stooped from years of standing over operating tables, her hands perpetually steady and capable. They told the story of a woman who believed problems were solved through work, not words. The small bronze star tucked away in her dresser drawer spoke of bravery she never discussed. "No sense dwelling on things you can't change," was Margaret's life philosophy, applied to everything from broken appliances to broken bodies. William, or Bill as Margaret had called him since their first date in 1975, had spent his career shaping young minds as an elementary school teacher. Beneath his patient exterior and soft blue eyes lay a will of iron that had served him well, both in controlling classrooms of rambunctious third-graders and in managing his stubborn wife. What Margaret didn't know was that before they'd met, William had served as a combat photographer in the final years of Vietnam, an experience he'd buried so deeply that sometimes he convinced himself it had happened to someone else. Their only daughter, Emily, had followed her mother's medical inclinations rather than her father's teaching career, becoming an emergency physician in Chicago. The 3-hour distance between them had grown greater than geographical miles, widened by Margaret's disapproval of Emily's divorce and her refusal to be a burden whenever health issues arose. "That mole's been there forever," Margaret would dismiss whenever William mentioned the dark spot between her shoulder blades. "Had it since Iraq, just another souvenir." He'd noticed it changing over the years, darkening, developing irregular borders. But Margaret would wave away his concerns with the same certainty she used to predict Michigan weather. "Nothing to fuss about, Bill. Had it checked back in '08. Doctor said it was nothing then. It's nothing now." Their small-town doctor, semi-retired Dr. Grayson, had never pushed the issue during Margaret's infrequent visits. "Some women of Margaret's generation would have to be bleeding out to see a doctor," he'd once confided to William. "Best not to push too hard unless absolutely necessary." So life continued in their comfortable routine, morning coffee on the porch when weather permitted, volunteer work at church, weekly calls to Emily, monthly dinner with Susan Williams, Margaret's war buddy who'd settled one town over, and yearly physical arguments that Margaret eventually conceded to, grumbling all the way to the clinic and back. Their 46th anniversary dinner changed everything. William had spent the afternoon preparing Margaret's favorite meal, pot roast with root vegetables and his special cornbread that always earned a second helping. Their anniversary tradition remained unchanged for 46 years. Home-cooked dinner, a single glass of champagne, and dancing to Sam Cooke's "You Send Me," the song that had played during their first dance as husband and wife. He laid out Margaret's good blue blouse on the bed, the one he had given her 3 Christmases ago that brought out the faded blue of her eyes. The January evening had turned cold with snow beginning to fall outside their bedroom window, coating the lake in a pristine white blanket that reflected the setting sun. "Margaret, you about ready? Dinner's almost done," William called from the doorway, wiping his hands on his apron. Margaret emerged from the bathroom, towel wrapped around her waist, droplets of water still clinging to her silver hair. Despite the years, William still felt that same flutter he'd experienced when they'd first met at his cousin's wedding. Margaret had aged well, still strong, still handsome in that weathered way of women who'd spent their lives in service to others. "Need help with those buttons?" he asked, knowing her arthritis sometimes made the small buttons difficult. "I can manage," she insisted, but stood still as William approached to help. This silent compromise had become part of their rhythm, her insistence on independence, his quiet assistance, neither acknowledging the exchange. As he helped her slip the blouse over her shoulders, William froze. The mole between her shoulder blades had changed dramatically since he'd last seen it during their summer trip to the lake. What had been a dark, roughly circular spot about the size of a pencil eraser had transformed into something larger, with irregular borders and varying shades of brown and black. Most concerning was the way it seemed to rise from her skin, no longer flat but almost textured. "Margaret," he said carefully, "when did this mole start changing?" Margaret shrugged, reaching for her comb. "It's fine, Bill. Been there forever." "It's different," he insisted, his teacher's voice emerging, the tone that brooked no argument from even the most defiant third grader. "It's bigger, and the shape has changed." "Of course it has. I'm older. Everything changes." Margaret met his eyes in the mirror, her expression softening at his concern. "Anniversary night isn't for doctor talk, honey. Let's enjoy our evening." William reluctantly finished helping her with her blouse, but his mind remained fixed on what he'd seen. Throughout dinner, he found himself watching Margaret's movements, looking for any sign of discomfort or pain. She caught him staring more than once, responding with a wink or a squeeze of his hand, misinterpreting his worry for romantic reminiscence. They were washing dishes together when the doorbell rang. "That'll be Emily's package," Margaret said, drying her hands. "She mentioned sending something for our anniversary." Instead, when William opened the door, he found their daughter-in-law Jessica standing there with little Lily, their 6-year-old granddaughter. Snow dusted their matching knit hats. "Surprise," Jessica said. "We were driving through on our way back from my mother's and thought we'd stop by to wish you happy anniversary. Hope we're not interrupting." "Never," William said, genuinely pleased despite his preoccupation. "Come in out of the cold." Lily bounded in with the energy only kindergartners possess, rushing straight to Margaret, who scooped her up in a bear hug. "Grandma, I lost another tooth," she announced, displaying the gap in her smile with pride. "Well, now the tooth fairy is going to go broke with you," Margaret teased, setting her down and hanging up her tiny coat. What happened next would forever mark a dividing line in William's mind, the moment between before and after. Margaret had crouched down to help Lily with her snow boots, her back to the little girl as she worked the stubborn zipper. Lily, peering over her grandmother's shoulder, suddenly pointed and asked in that crystal-clear voice of childhood, "Grandma, why is there a spider on your back?" The room went still. Jessica laughed nervously, admonishing, "Lily, don't be silly." But Lily persisted with the unfiltered honesty of children. "It looks like the spider we found in the bathtub, the one with the bumpy back." Margaret straightened, reaching awkwardly behind herself. "There's no spider, sweetie. Grandma just has an old spot there." William exchanged glances with Jessica, whose expression shifted from embarrassment to concern. "Margaret," William said quietly. "Let me see." "It's nothing," she insisted. But William was already moving toward her, gently turning her around. "Let me check, just to be sure," he said, his voice calm while his heart raced. He lifted the back of her blouse, and Jessica gasped softly. "Margaret," William said, his voice steadier than he felt. "I'm taking a picture of this with my phone, and you're going to look at it." For once, Margaret didn't argue. When William showed her the photo, her face paled beneath her perpetual tan. The mole had transformed dramatically, even since he'd seen it earlier that evening. The irregular borders now resembled appendages reaching outward, and the center had risen into a dome-like structure with a texture that, as Lily had innocently observed, resembled the body of a garden spider. "I'm calling Dr. Grayson tomorrow," William said firmly. "No arguments." Margaret nodded, the sight of the growth seemingly shocking her into silence. That night, after Jessica and Lily had gone, William lay awake beside Margaret, listening to her breathing. For the first time in their marriage, he heard fear in the uneven rhythm of her inhales and exhales. Sometime past midnight, he felt her stir. "Bill," she whispered. It hurts. Never hurt before." William reached for her hand in the darkness. "First thing tomorrow, Margaret. I promise." Dr. Grayson's office squeezed them in between appointments the following morning. The elderly doctor's usual jovial demeanor disappeared the moment he examined Margaret's back. "I'm referring you to a dermatologist," he said, already writing on his prescription pad. "Dr. Rachel West. She's young but brilliant. Just moved back to the area after practicing in Boston. I'm calling her office personally to get you in this week." "That's serious?" Margaret asked, attempting her usual nonchalance. Dr. Grayson met her eyes directly. "I don't want to speculate, but this needs expert attention immediately." In the car ride home, Margaret stared silently out the window at the snow-covered landscape. William reached across the console to take her hand. "It'll be okay," he said, though uncertainty edged his voice. "If it's what I think it is," Margaret said quietly, "I need you to promise me something. Anything. Don't tell Emily until we know for sure." "No sense worrying her if it turns out to be nothing." William nodded, though he suspected they were well past nothing. That night, William woke to Margaret thrashing in her sleep, murmuring words he couldn't understand. When he touched her shoulder, she jerked awake with a gasp. "You were having a nightmare," he said. Margaret sat up, rubbing her face. "Been having the same dream for weeks now. I'm back in the desert and something's crawling on me. Can't get it off." William's blood ran cold. "Weeks? You've been having this dream for weeks and didn't tell me?" Margaret shrugged. "Just a dream, Bill." "And the mole? Has it been bothering you?" A long pause followed before Margaret admitted, "Sometimes it feels warm. And lately, I could swear." She trailed off. "What?" "You'll think I'm crazy." "Try me." Margaret looked at him, vulnerability naked in her eyes. "Sometimes I swear I can feel it move." 3 days later, William sat beside Margaret in Dr. Rachel West's waiting room, watching her pretend to read a Sports Illustrated from 2019. Her knuckles were white around the edges of the magazine, betraying the anxiety she refused to voice. The dermatology clinic was newer than most buildings in their small town, with its sleek furniture and calming blue walls, a stark contrast to Dr. Grayson's office with its decades-old decor. Margaret Harrison, a young nurse, appeared at the door, clipboard in hand. "Dr. West is ready for you." Margaret stood, squaring her shoulders like a woman facing a firing squad. William reached for her hand, but she had already started walking, leaving him to follow in her wake. Dr. Rachel West was younger than William had expected, maybe late 30s, with intelligent eyes behind stylish glasses and a warm smile that put William at ease despite his concerns. She introduced herself with a firm handshake, then immediately addressed Margaret directly. "Mrs. Harrison," Dr. West began. "Dr. Grayson sent over his notes, but I'd like to examine the area myself, if that's all right." Margaret nodded, already unbuttoning her blouse with military efficiency. As she turned and sat on the examination table, Dr. West's professional demeanor momentarily slipped. Her eyes widened before she quickly composed herself. "How long have you had this growth, Mrs. Harrison?" she asked, pulling on latex gloves. "Had a mole there since Iraq," Margaret answered. "Been changing lately." "Define lately," Dr. West prompted, examining the growth without touching it. "Noticeable changes in the past 6 months," William interjected when Margaret hesitated, "but dramatic changes just in the past week." Dr. West nodded, taking photographs with a specialized camera. "And any symptoms? Pain, itching, bleeding?" "Some discomfort recently," Margaret admitted. "Nothing I can't handle." "She's been having nightmares," William added. "And she said sometimes it feels warm." "Doctor." West raised an eyebrow. "Anything else you've noticed, Mrs. Harrison? Even if it sounds unusual." Margaret hesitated, glancing at William. "Sometimes, and I know this sounds crazy, sometimes it feels like it's moving." Instead of dismissing this, Dr. West leaned closer to examine the growth. "Movement sensations aren't uncommon with certain types of growths. The surrounding nerve endings can create that impression." She pressed gently around the edges of the growth, causing Margaret to flinch. "Sorry," she said. "I need to check the borders." After several more minutes of examination, Dr. West stepped back and removed her gloves. "I'd like to do a biopsy today, if that's all right with you." "A biopsy?" Margaret repeated. "That's where you cut out a piece to test it?" "Exactly. We'll numb the area first, of course. It's a standard procedure that will give us the information we need to proceed." "Proceed with what?" William asked, his heart racing. "Doctor." West met his eyes directly. "I don't want to speculate until we have the biopsy results, but this doesn't present as a typical melanoma or basal cell carcinoma. The structure is unusual." "Cancer." Margaret's voice was flat. "The biopsy will tell us more," Dr. West said diplomatically. "But I want to be straightforward with you. I'm concerned enough that I'd like to expedite the results. We should know something within 48 hours. As Dr. West prepared for the biopsy, William watched Margaret's face harden into the expressionless mask he recognized from difficult times throughout their marriage. When her father died, when they lost their second pregnancy, when Emily announced her divorce, it was the face of a woman battening down the hatches before a storm. The biopsy procedure was quick but tense. Despite the local anesthetic, Margaret winced when Dr. West extracted a small portion of the growth. William noticed the doctor's frown as she placed the sample in a container. "The tissue is denser than I expected," she commented, almost to herself. "I'm going to take one more sample from a different area, if that's all right." The second sample seemed to trouble Dr. West even more. She labeled both containers carefully before addressing them again. "I'm sending these to the lab today. I've marked them for priority processing." She handed Margaret a bandage care sheet. "Please keep the area clean and dry. If you notice any increased pain, bleeding, or other changes, call my office immediately, day or night. I've written my cell phone number on the back of my card." In the car ride home, William finally voiced the fear that had been building since Dr. West's reaction. "She's worried more than she's saying." Margaret stared straight ahead at the road. "Let's not get ahead of ourselves, Bill. Could be nothing." "Margaret Harrison, in 46 years of marriage, I've never known you to be a liar. Don't start now." That night, while Margaret slept fitfully, William made a decision. He retrieved the small digital camera they used for holidays and family gatherings and set it up on the dresser, angled toward their bed. If Margaret thought the growth was moving, he wanted proof, either to confirm her fears or to put them to rest. The next morning, William reviewed the footage while Margaret showered. Most of it showed nothing unusual, just Margaret sleeping on her side, occasionally shifting position. But at 3:17 a.m., the footage captured something that made William's blood run cold. As Margaret rolled onto her stomach, the bandaged area of her back seemed to ripple slightly, the medical tape lifting at one edge as if something beneath it was shifting. He quickly closed the camera when he heard the water shut off. This wasn't something to show Margaret, not yet. Not until he understood what they were dealing with. The call from Dr. West came that afternoon earlier than expected. "Mr. Harrison, is your wife with you?" Her voice was controlled but urgent. "She's out in the garage. Should I get her?" "Please, I'd like to speak with both of you." William found Margaret tinkering with their ancient lawnmower, though grass wouldn't need cutting for months. "Dr. West is on the phone," he said. "She wants to talk to both of us." Margaret wiped her hands slowly on a rag, a deliberate process that told William she was steeling herself. They returned to the kitchen where William put the call on speaker. "Mr. and Mrs. Harrison, thank you for taking my call," Dr. West began. "I've received preliminary results from the lab, and I'd like you to come in tomorrow morning to discuss them in person." "Just tell us now, Doc," Margaret said gruffly. "Is it cancer?" A pause. "The results are inconclusive in some ways. There are abnormal cells present that share characteristics with melanoma, but there are other findings that don't fit that diagnosis." "What does that mean?" William asked. "It means we need to do a more extensive removal and examination. I've consulted with Dr. Michael Bennett, an oncologist here in our hospital. He's agreed to see you tomorrow at 9:00 a.m. "I'll be there as well." After they hung up, Margaret stood silently by the kitchen counter, her face unreadable. "Margaret?" William prompted gently. "Knew a woman in my unit," she said finally. "Got some desert rash that the medics couldn't figure out. Turned out she had some kind of parasite burrowed under her skin." She looked at William, her eyes haunted. "You think that's what this is? Some Iraqi bug that's been living in me all these years?" The question chilled William to the bone because the thought had already occurred to him, not from Margaret's military service, but from his own. He had photographed strange tropical infections during his time in Vietnam, things that weren't in any military manual. "I don't know," he answered honestly, "but whatever it is, we'll face it together." That evening, they received an unexpected visitor. Susan Williams knocked on their door just after dinner, her gray hair wind-blown and her expression serious. "Heard from Patty down at the clinic that Margaret's got some kind of growth they're checking out," she said without preamble when William opened the door. Patty Johnson was Susan's sister-in-law and a nurse at the medical center. "News travels fast," Margaret commented dryly from the living room. Susan entered, declining William's offer of coffee. "Show me," she said to Margaret. The two women had been through too much together for Margaret to refuse. She turned and lifted her blouse, revealing the bandaged area. "The shape of it?" Susan asked. "Sort of spider-like, I guess," Margaret answered, glancing at William. "Lily called it that." Susan's weathered face paled. "Thought so. Martinez had something similar." "Who?" William asked. "Jennifer Martinez," Margaret supplied. "Trauma nurse from our forward surgical team. Good with the most critical cases." Susan nodded. "Ran into her husband about 5 years back at a VA event. He told me she died from some weird cancer. Started as what they thought was a mole on her back. By the time they figured out what it was, it had spread everywhere." William felt his knees weaken and sat beside Susan. "Did they ever determine what caused it?" Susan shrugged. VA doctors had some theory about chemical exposure from the oil field fires. Said it created some unique type of cancer they hadn't seen before. She looked directly at Margaret. "You were with us near Basra, weren't you?" Margaret nodded grimly. 3 weeks in '03. William looked between them. "Basra?" "Where the worst oil fires were," Susan explained. "You could tell because the sky would turn black for days." The three sat in heavy silence until Susan spoke again. "There's something else you should know, Margaret. Before Martinez died, she told her husband the same thing you've been telling Bill. She thought the thing on her back was moving." The waiting room of the oncology department felt colder than the January morning outside. William sat with his hands folded tightly in his lap, watching Margaret flip through a month-old Time magazine without seeing the pages. They had barely spoken during the drive to the hospital, each lost in their own thoughts after Susan's disturbing revelation the night before. "Margaret and William Harrison?" A nurse in blue scrubs appeared at the door, clipboard in hand. "Dr. Bennett and Dr. West are ready for you." They followed her down a hallway lined with framed watercolors of peaceful landscapes, an attempt at calming that only heightened William's anxiety. The consultation room contained a small conference table rather than an examination bed, suggesting this was a meeting for discussion, not treatment. Dr. West greeted them with a professional smile that didn't quite reach her eyes. Beside her stood Dr. Michael Bennett, a tall man with silver hair and reading glasses perched on the end of his nose. He shook their hands firmly, his demeanor radiating the confidence of someone who had delivered difficult news countless times before. "Thank you for coming in," Dr. Bennett began once they were seated. "Dr. West has shared the biopsy results with me, and I've reviewed them thoroughly. We've also consulted with a pathologist at the University of Michigan Medical Center." "Just give it to us straight, Doctor," Margaret said, her voice gruff. "What are we dealing with?" Dr. Bennett nodded, appreciating Margaret's directness. "The biopsy shows characteristics of an atypical melanoma, but with several unusual features. The cellular structure is distinctive, not something we commonly see." "Is it from chemical exposure?" William asked, remembering Susan's story. "My wife was exposed during her service in Iraq." The doctors exchanged glances before Dr. West spoke. "That's one possibility we're considering. There have been documented cases of rare cancers linked to chemical exposure during the war." "But there's something else," Dr. Bennett added, opening a folder on the table. He turned it to show them photographs of the biopsy samples magnified to show cellular details that meant nothing to William or Margaret. "The growth appears to have encapsulated some type of foreign material." "Foreign material?" Margaret repeated. "Something that doesn't belong in human tissue," Dr. Bennett clarified. "We won't know exactly what until we remove the entire growth and analyze it." "When?" William asked. "As soon as possible," Dr. West said firmly. "I've scheduled an operating room for tomorrow morning. This isn't something we want to leave in place any longer than necessary." Margaret leaned forward, fixing both doctors with a steady gaze. "Level with me. Is this thing going to kill me?" Dr. Bennett removed his glasses, meeting Margaret's eyes directly. "Without removal and proper treatment, yes, eventually it could. But caught at this stage with appropriate intervention, your prognosis could be quite good. We simply need more information, which we'll get from the complete excision." As they discussed surgical procedures and recovery expectations, William's mind drifted back to his days as a military photographer. He had documented strange tropical infections, unusual reactions to environmental exposures, but nothing like what was growing on Margaret's back. Part of him wondered if he should reveal his military background to the doctors, but something held him back, a sense that his past and Margaret's condition were connected in ways he didn't yet understand. After signing consent forms and receiving pre-surgical instructions, they made their way back to the parking lot. Snow had begun falling again, large flakes drifting lazily in the still air. "Should we call Emily?" William asked as Margaret scraped ice from the windshield. She paused, the scraper mid-stroke. "Not yet. Let's wait until after tomorrow when we know more." She resumed the rhythmic scraping with more force than necessary. No sense worrying her if this turns out to be simple. William wanted to point out that nothing about this situation seemed simple, but he recognized Margaret's need to maintain some control, to protect their daughter even now. Back home, William called their pastor to ask for prayers, made arrangements with their neighbor to collect mail, and packed an overnight bag while Margaret sat at the kitchen table methodically cleaning her surgical loops, though her retirement was 5 years behind her. "Should call Susan," she said suddenly. "Ask her if she remembers anyone else from our unit with similar symptoms." William nodded. "Good idea. I'll make us some lunch first." As he assembled sandwiches, his mind kept returning to the video he'd taken of Margaret's back. Should he show it to the doctors? Would they think he was overreacting? Or worse, would they dismiss Margaret's sensations as imagination if they didn't see movement themselves? He was still debating when the phone rang. It was Emily. "Dad, is everything okay? Pastor Jim just called to check on you and Mom. Said something about Mom having a procedure tomorrow." William closed his eyes, silently cursing small-town communication networks. "We were going to call you after we knew more, honey." "Knew more about what? Dad, what's going on?" With a sigh, William explained the situation as calmly as he could, downplaying their concerns while still conveying the seriousness. "I'm coming," Emily declared before William had finished. "I can be there by tonight." "Emily, you don't need to—" "Dad?" The steel in his daughter's voice was painfully familiar. It was Margaret's determination in a younger female version. "My mother is having surgery to remove a potentially cancerous growth tomorrow. I'm coming." End of discussion. After hanging up, William returned to the kitchen to find Margaret staring out the window at the falling snow, her sandwich untouched. "Emily's on her way," he told her. She nodded without turning. "Figured she would be. She's stubborn like her mother." "Like her father, you mean?" A ghost of a smile crossed her face. "Maybe a bit of both." That evening, Margaret's discomfort increased noticeably. She shifted constantly in her chair during dinner, unable to find a position that didn't pressure the growth. By bedtime, she admitted to a burning sensation that over-the-counter pain relievers barely touched. "Maybe we should call Dr. West," William suggested, watching her wince as she tried to get comfortable in bed. "And say what? The thing you're cutting out tomorrow hurts today?" "Nothing they can do tonight, Bill." She was right, but sleep eluded him nonetheless. Around midnight, he heard Emily's car in the driveway. Their daughter had made the 3-hour drive from Chicago in record time, despite the snow. William met her at the door, embracing her tightly. At 40, Emily still looked so much like the serious little girl who had once declared she wanted to fix people when she grew up. Now, an emergency physician, she had fulfilled that childhood ambition. "How is she?" Emily asked, shrugging off her coat. "Pretending it doesn't hurt as much as it does." William answered honestly. "You know your mother." Emily nodded, her expression grim. "And what aren't you telling me, Dad? I could hear it in your voice on the phone." William hesitated, then led Emily to the kitchen table. "There's something I need to show you," he said, retrieving his camera. Emily watched the nighttime footage in silence, her professional demeanor firmly in place. Only the slight whitening of her knuckles as she gripped the camera revealed her distress. "Have you shown this to her doctors?" she asked when the video ended. "Not yet. I wasn't sure if they'd take it seriously." "They will. This confirms what Mom's been feeling isn't imagined." She looked at William with narrowed eyes. "There's something else, isn't there? Something you're not telling me." William sighed, suddenly feeling the weight of secrets kept for decades. "Not now, Emily. After the surgery, when we know what we're dealing with." Morning arrived with a sense of suspended reality. Margaret was uncharacteristically quiet as they prepared to leave, methodically going through her pre-surgery checklist as if preparing for a military operation. No food or drink after midnight. Shower with the special antibacterial soap. No jewelry or metal objects. At the hospital, the admitting process moved with well-oiled efficiency. Margaret was taken to a preparation room while William and Emily settled in the surgical waiting area. Dr. West stopped by briefly, her confident smile providing a measure of reassurance. "We've assembled an excellent team," she told them. "Dr. Bennett will be assisting, along with Dr. Patel, who specializes in complex dermatological surgeries. We're going to take very good care of Margaret." William nodded gratefully, then remembered the video. "Dr. West, there's something you should see before you begin." He handed over his camera, briefly explaining what he'd captured. The doctor's professional composure slipped as she watched, her eyes widening slightly. "Thank you for showing me this, Mr. Harrison. It's helpful information." She handed back the camera. "I'll discuss this with the surgical team immediately." After Dr. West left, Emily turned to William with questions in her eyes. "Dad, what do you think is really going on? And don't tell me you don't have theories. I know that look." William hesitated, then decided his daughter deserved honesty. "Before I met your mother, before I became a teacher, I was a combat photographer." Emily blinked in surprise. "A photographer? You never told me that. In Vietnam?" "That's where I learned photography, in field units during the final years of the war." "Why would you keep that secret?" William stared down at his weathered hands. "When I came home, people didn't exactly celebrate those who'd been part of that war. And the things I saw there, I wanted to forget, to start fresh. Teaching seemed like a way to create rather than just document." He looked up at his daughter. "Your mother doesn't know." "Doesn't know what? That you were in Vietnam?" "She knows that part. We met after I'd already changed careers. What she doesn't know is that I documented cases similar to hers, growths that weren't quite cancer, not quite infection. The military doctors called them encapsulation responses. The body would create elaborate structures around foreign objects, sometimes shrapnel, sometimes environmental contaminants. Emily absorbed this revelation in silence before asking, "What does this have to do with Mom's condition?" "I photographed soldiers with unusual tropical conditions, infections that behave differently from anything in medical textbooks. And once I documented a case similar to your mother's, a growth that seemed to have its own movement patterns." "What was it?" "We never definitively knew. The soldier was evacuated to Germany before final diagnosis. But the working theory was that his body was encapsulating shrapnel, creating a kind of protective cocoon that eventually developed its own blood supply." Emily's medical mind engaged visibly. "Like an advanced foreign body reaction? That's rare, but not unheard of." "This was different," William insisted. The encapsulation had developed abnormal tissue that resembled cancer but wasn't quite the same. The military doctors were fascinated but also disturbed. Their conversation was interrupted by a nurse informing them that Margaret's surgery had begun. Now there was nothing to do but wait, the minutes stretching into hours marked only by the steady tick of the waiting room clock and the occasional announcement over the hospital intercom. While Emily made a phone call to her department in Chicago, William found himself drawn to the small chapel off the main corridor. He wasn't particularly religious, but the quiet space offered a refuge from the antiseptic brightness of the waiting room. As he sat in the dimly lit chapel, his mind wandered to the metal box hidden in his workshop at home. Unlike Margaret's bronze star tucked away in her dresser, his box contained photographs he'd never shown anyone, images from Vietnam that documented the darker side of warfare, including the medical cases that now seemed so relevant. Perhaps it was time to open that box, to share with Margaret the truth of his service, just as she might now be forced to confront the physical remnants of hers. His contemplation was interrupted when Emily found him. "Dad, Dr. Bennett is looking for us." William's heart stuttered. "Has something happened?" "He just said he wanted to update us. The surgery is still in progress." They found Dr. Bennett in the waiting room, still wearing his surgical cap. His expression was unreadable as he approached them. "The surgery is still in progress," he began, "but Dr. West asked me to update you. We've encountered some unexpected findings." William's throat tightened. "What kind of findings?" "The growth is more extensive than the imaging suggested. It has developed a network of fibrous extensions beneath the surface of the skin." He hesitated, choosing his words carefully. "And we've confirmed there is a foreign object embedded within the growth itself." "What kind of foreign object?" Emily asked, her physician's demeanor taking over. "That's what we're working to determine now. It appears to be metallic in nature." Dr. Bennett looked directly at William. "Mr. Harrison, does your wife have any history of shrapnel wounds or other embedded foreign bodies from her military service?" William shook his head slowly. "Not that she ever mentioned. She received a Bronze Star, but she never talked about the circumstances." Dr. Bennett nodded thoughtfully. "We're proceeding carefully to remove both the growth and the embedded object intact. Dr. West will come speak with you when the procedure is complete." After he left, Emily turned to William, her face pale. "Dad, this sounds exactly like what you just described." "The case from Vietnam." William nodded, a chill running through him despite the overheated waiting room. "I know. If Mom has had shrapnel in her body all these years without knowing it, then what else hasn't she told us about her time in Iraq?" The question hung between them as they continued their vigil, each lost in thought about the woman they both loved and the secrets she might have carried for nearly 2 decades. The surgical suite maintained its sterile hush, broken only by the steady beep of monitoring equipment and the occasional metallic clink of instruments. Dr. Rachel West stood over Margaret Harrison's prone form, her focus absolute as she carefully separated the growth from the surrounding tissue. "Remarkable structure," she murmured, more to herself than to her surgical team. "I've never seen anything like this network of fibrous extensions." Dr. Bennett leaned closer, his experienced eyes narrowing behind his magnification loupes. "Almost like it's anchoring itself deliberately. See how these tendrils follow the fascial planes? Blood pressure holding steady at 110/70, the anesthesiologist reported from behind his monitors. Dr. West nodded acknowledgement without looking up, her hands steady as she traced another extension of the growth. "I want to keep this as intact as possible for pathology. Nurse Johnson, can you adjust the lighting?" Patricia Johnson, head surgical nurse with 30 years of experience, repositioned the overhead lamp to better illuminate the operating field. In all her years at Pinecrest Regional Hospital, she'd never seen anything quite like what lay exposed on Margaret Harrison's back. "Dr. West," she said, "the base is pulsing slightly with her heartbeat. See it?" Indeed, the central mass of the growth seemed to have its own blood supply, synchronizing with Margaret's cardiac rhythm. Dr. West carefully clamped and tied off several small vessels feeding the mass. "We're getting close to the foreign body," she observed as her scalpel revealed a deeper layer of tissue. "I can see something reflective." Dr. Bennett adjusted his position for a better view. "Definitely metallic. Could be shrapnel, as we suspected." As Dr. West carefully dissected the final layer of tissue encapsulating the foreign object, she paused, frowning. "This is unusual. The growth seems to have formed a perfect cavity around whatever this is." Using delicate forceps, she gently probed the exposed edge of the metallic object. It shifted slightly, revealing a distinctive shape. "That's not random shrapnel," Dr. Bennett said, his voice tense with surprise. "That appears to be a bullet fragment." Dr. West carefully worked her instruments around the object, freeing it from the surrounding tissue. As she lifted it away from the cavity, the full structure became visible, a misshapen piece of metal approximately 1 centimeter in length, its surface corroded but still recognizably part of a bullet. "My God," Nurse Johnson whispered, the words escaping involuntarily. Then louder, a reflexive cry of shock as the tissue around the now empty cavity seemed to collapse and then restructure itself before their eyes. "Oh my God!" Her scream echoed through the surgical suite, startling everyone present. Through the observation window, William Harrison pressed his hands against the glass, his heart racing at the sudden commotion. "What is it?" Dr. Patel asked sharply, moving closer to see what had caused the experienced nurse's outburst. Dr. West remained steady, though her eyes widened behind her surgical mask. "The tissue, it's reconfiguring. I've never seen anything respond like this to foreign body removal. It's as if it was built around the bullet fragment," Dr. Bennett said, his scientific curiosity temporarily overriding his surprise. "The body created this elaborate structure to isolate it, or to use it," Dr. West murmured, placing the bullet fragment carefully in a specimen container. "Look at how the growth interfaced with it, almost like it was utilizing the metal as a framework." Nurse Johnson regained her professional composure, though her hands trembled slightly as she assisted with the instruments. "I'm sorry for the outburst, doctors. I've just never seen tissue behave that way." "None of us have," Dr. Bennett assured her, returning his attention to the surgical field. "Now let's complete the excision and close. I think we've given the Harrisons enough drama for one day." Dr. West nodded, focusing on removing the remaining tissue and ensuring clean margins. "I want comprehensive testing on both the growth and the bullet fragment, full histopathology, toxicology, and metal analysis." In the observation room, William and Emily watched intently, unable to hear the conversation but sensing the gravity of what had just occurred. "Something happened," Emily said, her physician's instincts alert to the shift in the surgical team's body language. "Something unexpected." William nodded, his heart pounding. The nurse screamed. "Patricia Johnson has been a surgical nurse longer than Dr. West has been alive. It would take something truly shocking to make her react like that." They fell silent as Dr. Bennett approached the observation window, his eyes meeting William's through his protective goggles. He gave a reassuring nod and a thumbs up, the universal sign that things were under control, before returning to assist with the closure. Another hour passed before Dr. West emerged from the surgical suite, her cap removed but still wearing her surgical gown. Her face showed both fatigue and excitement, the look of a physician who had encountered something professionally fascinating. "Mr. Harrison, Dr. Harrison," she acknowledged William and Emily formally. "Margaret is stable and being moved to recovery. The surgery was successful in that we removed the entire growth and what appears to be the causing agent." "Causing agent?" Emily repeated, her medical training engaging. "What did you find?" Dr. West gestured toward the consultation room. "Let's sit down. This will take some explanation." Once seated, Dr. West placed a sealed specimen container on the table. Through the clear plastic, William could see a small, misshapen piece of metal. "This was embedded in the center of the growth on Margaret's back," Dr. West explained. "It's a bullet fragment, approximately 15 years old based on its condition and composition." William stared at the fragment, his mind racing back to his days as a military photographer, to wounded soldiers and field surgeries. Margaret never mentioned being shot. "Many veterans don't discuss their injuries," Dr. West said gently, "especially wounds that weren't life-threatening at the time." "But how could she not know?" Emily asked, examining the fragment without touching the container. "Surely she would have felt being hit. In combat, especially under intense conditions, it's not uncommon for soldiers to sustain injuries they're unaware of until later," Dr. West explained. And if the entry wound was small enough, field medics might have cleaned and bandaged it without extracting the fragment, especially if it wasn't easily accessible. William nodded slowly, remembering triage protocols from his own service. If it wasn't threatening vital organs, they would have prioritized more critical injuries. Exactly, Dr. West confirmed. But what's truly remarkable is what her body did in response to this foreign object over the decades. She pulled out several photographs taken during surgery. Laying them on the table, William and Emily leaned forward to see detailed images of the growth, its spider-like extensions, and the cavity where the bullet had resided. Instead of forming a simple scar capsule around the fragment, which is the normal response to a foreign body, Margaret's immune system created this elaborate structure, Dr. West explained, pointing to various features in the photos. It's unlike anything I've seen in medical literature. But why now? Emily asked. Why would it suddenly change and become symptomatic after all these years? Dr. West shook her head. That's one of many questions we don't have answers for yet. It could be age-related immune changes, environmental factors, or simply that the structure reached a critical mass. She looked directly at William. Has Margaret been exposed to any unusual chemicals or environments recently? William thought carefully. Nothing out of the ordinary, just her usual routine. Gardening, volunteer work at the hospital, church activities. What about her diet or medications? She takes blood pressure medication and a daily aspirin. Nothing else regularly. Dr. West made notes on her tablet. We'll run a full panel of tests on the tissue and the fragment. The preliminary findings are intriguing. Intriguing how? Emily pressed, her professional curiosity evident. The growth shows characteristics of both cancerous and non-cancerous tissue. It had developed its own blood supply like a tumor, but was contained and organized in a way tumors typically aren't. And the tissue immediately surrounding the bullet fragment had an unusual cellular structure, almost metallic in composition, as if it had been absorbing microscopic particles from the fragment itself. William felt a chill at these words, remembering similar descriptions from military doctors in Vietnam. Is it dangerous? Could it spread or return? He asked. We took wide margins to ensure complete removal, Dr. West assured him, and we'll monitor Margaret closely. But until we understand exactly what we're dealing with, I can't make definitive predictions. A nurse appeared at the doorway. Dr. West, Mrs. Harrison is awake and asking for her family. Relief washed over William. Can we see her now? Dr. West nodded briefly. She'll be groggy from the anesthesia and on pain medication. We'll keep her overnight for observation, but barring complications, she should be able to go home tomorrow. They followed the nurse to the recovery area where Margaret lay, propped on her side to avoid pressure on her surgical site. Her face was pale, but her eyes were alert as they approached. There's my family, she said, her voice raspy from the intubation tube. Surgery go okay? William took her hand, struggling to maintain composure. It went fine. They got everything out. Margaret's gaze shifted between them, her perception sharp despite the medications. What aren't you telling me? Emily stepped forward, ever the doctor, even with her own mother. They found a bullet fragment embedded in the growth, Mom. You had a piece of metal in your back, apparently for years. Margaret's expression didn't register surprise, only a weary confirmation. Figured it might be something like that. William stared at her. You knew? Not for sure, she admitted. But I took some shrapnel during a firefight near Basra in '03. Medic patched me up, said most of it was superficial. She closed her eyes briefly. One piece went deeper. They were going to airlift me to the field hospital, but then we took heavy fire again. By the time it was over and we got back to base, the wound had closed up. They figured if it wasn't causing problems, best to leave it alone. And you never thought to mention this? William couldn't keep the hurt from his voice. Margaret's eyes opened, meeting his with a mixture of apology and defensiveness. When I got home, everyone was either treating vets like we were damaged goods or looking at us with pity. I didn't want either. I just wanted to move forward. Her hand tightened around his. And by the time I met you, it seemed like ancient history. Never gave me any trouble until now. Well, it's out now, Emily said pragmatically. And they're running tests to understand exactly what it was doing in there all these years. Margaret nodded, then winced as the movement pulled at her stitches. So, what happens next? Rest and recovery, William said firmly. And no more secrets, Margaret Harrison. Not about your health, not about Iraq, not about anything. A faint smile crossed her pale face. Yes, sir. Later, after Margaret had drifted back to sleep and Emily had gone to make phone calls, William stood by the recovery room window, watching snow fall in the early winter darkness. Dr. West found him there, 2 cups of coffee in hand. Thought you might need this, she offered, passing one to William. Thank you. William accepted gratefully, the warmth of the cup comforting against his cold fingers. They stood in companionable silence for a moment before Dr. West spoke. Your wife is a remarkable woman. She paused. Not many people could carry something like that for decades without knowing. William nodded, watching Margaret's chest rise and fall in sleep. She's carried more than that, I think. Things she never talks about from the war. That generation often doesn't, Dr. West said softly. My father was in Iraq, too. First Gulf War. He didn't speak about it until he was diagnosed with terminal cancer. Then the stories came pouring out like he couldn't take them with him. William turned to study the young doctor with new understanding. Is that why you came back to a small-town practice? Because of your father? Dr. West smiled sadly. Partly. He died during my residency in Boston. Coming back here felt like a way to honor him, to serve the kind of community he valued. She hesitated, then added, When I saw what we removed from your wife today, I thought of my father. He carried his war in his nightmares. Margaret carried hers physically in her body. The metaphor struck William deeply. We all carry something, I suppose. Mr. Harrison, Dr. West said carefully, there's something else you should know. The preliminary examination of the growth shows unusual properties. We're sending samples to specialists at Walter Reed and the CDC. This could be an important case for understanding how the body responds to foreign objects long-term, especially in veterans exposed to environmental hazards. William tensed. Are you saying Margaret might become some kind of research subject? Nothing invasive, Dr. West assured him quickly. Just analysis of the tissue we've already removed, but the findings could potentially help other veterans facing similar issues. William considered this, watching his wife sleep. How many others might be carrying fragments of war in their bodies, ticking time bombs waiting to manifest decades later? Whatever helps others, he finally said. Margaret would want that, but her recovery comes first. Absolutely, Dr. West agreed. And speaking of recovery, you should get some rest yourself. We have your cell number. We'll call immediately if there's any change. William nodded but made no move to leave. I'll stay a while longer just to be sure she's resting comfortably. Dr. West understood. With a gentle squeeze of William's shoulder, she left him to his vigil. Alone with his sleeping wife, William finally allowed himself to process the day's revelations. Margaret had carried a piece of the war inside her for their entire marriage, and he had carried his own secret. His experiences as a combat photographer, the horrors he'd witnessed and tried to forget. Perhaps it was time for both of them to unburden themselves of the past they'd been carrying for far too long. Margaret's homecoming the following day should have marked the beginning of recovery, but life rarely follows expected paths. William had prepared their bedroom with extra pillows, arranged her medications on the nightstand, and stocked the refrigerator with easy meals. Emily had taken a week's leave from the emergency department to help with her mother's care, setting up a makeshift office in the spare bedroom. The first 2 days passed uneventfully. Margaret slept most of the time, the pain medication keeping her drowsy but comfortable. She followed post-surgical instructions with military precision, allowing William to change her dressings and taking antibiotics without complaint. The surgical site looked clean, with no signs of infection or unusual healing. On the 3rd day, everything changed. William woke at dawn to find Margaret's side of the bed empty, the sheets cold. He found her in the kitchen, sitting rigidly at the table, staring into a cup of untouched coffee. Her face was ashen with a light sheen of sweat despite the chill in the early morning air. "Margaret, what are you doing up so early?" He approached cautiously, alarmed by her appearance. "Couldn't sleep," she said, her voice strained. "Back's on fire." William immediately placed his palm on her forehead, feeling the heat radiating from her skin. "You're burning up. When did this start?" "Middle of the night. Thought it might pass." She winced as she shifted position. "It's getting worse." Emily appeared in the doorway, already dressed for the day. Her clinical gaze assessed her mother instantly. "Mom, you need to lie down. Let me look at your back." In their bedroom, William helped ease Margaret's pajama top over her shoulders while Emily snapped on latex gloves from her medical bag. The bandage covering the surgical site was spotted with a rust-colored discharge. "This doesn't look right," Emily murmured as she carefully removed the dressing. What lay beneath caused both William and Emily to inhale sharply. The incision, which had been healing normally the previous evening, was now angry and inflamed. The skin around the stitches had taken on a peculiar, mottled appearance, with areas of deep redness interspersed with pale, almost bloodless patches. Most concerning was the distinct swelling that seemed to pulse slightly with each beat of Margaret's heart. "We need to get her back to the hospital," Emily said, her professional demeanor firmly in place despite the fear William could see in her eyes. Now, within the hour. Margaret was back in the emergency department, her temperature climbing to 103, as Dr. West examined the surgical site with growing concern. "This isn't a typical post-surgical infection," she said, gently probing the swollen tissue. "I'm seeing unusual characteristics in the inflammatory response." She looked up at William. "Did anything change in the last 24 hours? Any new medications, foods, environmental exposures?" William shook his head. "Nothing." She was following all the instructions. Dr. West turned to the emergency room nurse. "I want broad-spectrum antibiotics started immediately, and alert Dr. Bennett. We need to consider taking her back to surgery to clean out this site." As the medical team rushed to implement orders, William found himself pushed to the periphery of the room, watching helplessly as his wife's condition deteriorated. Her breathing had become labored, and the monitor showed her heart rate increasing as her body fought whatever was invading it. Emily approached, putting an arm around her father's shoulders. "They're doing everything right, Dad. The infection just took hold incredibly fast." "This isn't just an infection," William said with quiet certainty. "This is something else." Before Emily could respond, Dr. Bennett entered the room quickly, donning gloves to examine Margaret. After a brief assessment, he conferred with Dr. West in low, urgent tones. William strained to hear their conversation. "Unusual presentation. Resistant to standard prophylaxis. Need to explore the site immediately." Dr. Bennett approached them, his expression grave but composed. "Mr. Harrison, we need to take Margaret back to surgery right away. There appears to be a severe inflammatory response developing at the surgical site, possibly with a resistant infection." "Do whatever you need to do," William said, clasping Margaret's hand. Her skin felt frighteningly hot against his. Margaret's eyes fluttered open, finding William's face. "Bill," she whispered, her voice barely audible. "If anything happens—" He cut her off firmly. "This isn't goodbye, Margaret Harrison. You're going to be fine." A ghost of her familiar smile crossed her face. Still giving orders after all these years. As they prepared to move her to surgery, Margaret suddenly gripped William's hand with surprising strength. "There's a metal box," she said urgently. "In my old medical bag in the attic. Combination is your birthday. If I don't—" She paused, struggling for breath. "You should know what's in there." William's throat tightened. "You can show me yourself when you're better." Margaret's eyes held his with an intensity that belied her weakened state. "Promise me you'll look." "I promise," he whispered, pressing a kiss to her forehead as the transport team arrived to take her to surgery. The surgical waiting room felt colder and more sterile than during their previous visit, the cheerful paintings on the walls now seeming mockingly bright against the gravity of the situation. William sat rigidly in the uncomfortable chair, his hands clasped so tightly that his knuckles had turned white. "Dad," Emily said gently, placing a cup of tea beside him. "You should try to drink something. It's going to be a long wait." William nodded absently, his mind elsewhere. "That box she mentioned. I never knew about any metal box in her medical bag." Emily sat beside him. "Mom has always been private about some things." "Too private," William said, a trace of bitterness creeping into his voice. 46 years of marriage, and she's still keeping secrets. "Everyone has parts of themselves they keep hidden," Emily observed. "Even you, Dad." William looked up sharply. "What do you mean? You never told me you were a combat photographer in Vietnam. Never mentioned you had military experience at all." The simple statement hung in the air between them. Not an accusation, but a recognition of a truth they both now understood. Their family had been built on a foundation of unspoken experiences, carefully omitted from the stories they told about themselves. "I wanted to forget that part of my life," William finally said. "When I came home, I couldn't bear to think about what I'd seen, what I'd done. Teaching children seemed like the opposite of documenting war, a way to build something instead of just trying to capture destruction." Emily nodded slowly. "And Mom probably felt the same way about her experiences." "But her secret nearly killed her," William said, his voice breaking. "If we'd known about that bullet fragment years ago, you can't know that it would have made any difference," Emily said, her physician's pragmatism emerging. "That growth could have formed regardless, or removing the fragment earlier might have caused different complications." Their conversation was interrupted by Susan Williams, who appeared in the waiting room doorway, her weather-beaten face creased with concern. "Heard Margaret was back in the hospital," she said, approaching them. "Patty called me." William nodded, grateful for her presence. Susan was the closest thing to family they had in town beyond Emily. Some kind of infection or reaction at the surgical site. They've taken her back into surgery. Susan settled her lanky frame into a chair across from them. "Tough old bird, your wife. She'll pull through." "You knew about the bullet, didn't you?" William asked suddenly. "You knew she'd been shot." Susan's silence was answer enough. After a moment she sighed heavily. "It was a bad day near Basra. We were treating casualties when our medical station came under mortar fire. Margaret took a hit, helping drag Johnson to cover." She paused, her gaze distant with memory. "By the time the medics got to her, there were men a lot worse off. The medic patched her up, said the bullet had fragmented, but most of it was removed." Susan looked directly at William. "Margaret never wanted a Purple Heart for it. Said too many better soldiers had died earning theirs." William absorbed this revelation, trying to imagine his wife as the young doctor Susan described, brave enough to risk her life for a comrade, humble enough to dismiss her own sacrifice. "Why wouldn't she tell me this?" he asked, the hurt evident in his voice. Susan shrugged. You didn't know Margaret right after she got back. None of us talked about what happened over there. It was like if we didn't say it out loud, maybe we could pretend it never happened. She looked directly at William. And Margaret changed after she met you. She wanted to be the woman you thought she was, not some damaged war vet. The irony of this statement wasn't lost on William. Hadn't he done the same thing? Reinvented himself as a school teacher, burying the combat photographer he had been. Hours passed with agonizing slowness. Susan went for sandwiches that none of them could eat. Emily made phone calls, arranging for more time away from her practice. William sat motionless, watching the institutional clock tick away minutes that felt like hours. Finally, near midnight, Dr. West appeared, still in surgical scrubs, her face drawn with fatigue. William stood immediately, reading the gravity in the doctor's expression. Margaret is in critical condition, Dr. West began, without preamble. We've cleaned out the surgical site and found an aggressive infection unlike anything I've encountered before. The tissue around the original incision was compromised. Compromised how? Emily asked, her medical training pushing through her personal concern. The infection appears to be causing rapid necrosis along the fascial planes where the growth had extended its tendrils. It's as if removing the growth triggered an inflammatory cascade that's destroying the surrounding tissue. Dr. West ran a hand through her hair, disheveling her surgical cap. We've placed drains and started her on 3 different antibiotics, but her body is under tremendous stress. Will she recover? William asked, the only question that mattered. Dr. West met his gaze directly. I can't make promises, Mr. Harrison. The next 24 to 48 hours will be critical. Her age and overall health work in her favor, but this infection is aggressive and unusual. Can I see her? William's voice was barely above a whisper. She's in ICU. You can visit briefly, but she's heavily sedated and on a ventilator to support her breathing while her body fights the infection. The ICU was a jarring contrast to the Margaret that William knew. His strong, independent wife lay unconscious, connected to machines that breathed for her, monitored her heart, and delivered medications and fluids. Her skin had a grayish pallor beneath the harsh lighting, and the rhythmic whoosh of the ventilator seemed to emphasize how tenuous her condition had become. William approached the bed slowly, carefully taking her hand between his. Her fingers were cool to the touch, the calluses that had always defined her surgeon's hands now seeming like artifacts of another life. I'm here, Margaret, he said softly, knowing she couldn't hear him but needing to speak nonetheless. You need to fight this. We have too many years ahead of us for you to check out early. Behind him, the ICU nurse adjusted an IV drip, her movements efficient but gentle. You can stay for 15 minutes, she said kindly. Then you should get some rest. We'll call if there's any change. William nodded, unable to tear his gaze from Margaret's face. In sleep, the years seemed to fall away from her. He could almost see the young doctor she had been, carrying the wounds of war silently within her for decades. I never told you, he whispered, leaning close to her ear. I was there too, Margaret. Not where you were, but in the same kind of war. I was a photographer before I was a teacher. I saw what those conflicts did to young men and women like you. His voice caught. Maybe if I'd told you, you would have felt safe enough to tell me about the bullet. Maybe we could have prevented this. There was no response, only the steady beep of monitors and the mechanical rise and fall of her chest. William pressed a kiss to her forehead and reluctantly allowed Emily to lead him away, with a promise to return at first light. That night, William couldn't sleep. Margaret's words echoed in his mind. There's a metal box. You should know what's in there. Whatever secrets she had kept locked away, she wanted him to discover them now, when she might never have the chance to explain them herself. At 3 in the morning, He found himself in the attic, the familiar smell of dust and old memories surrounding him like a presence. Margaret's medical bag sat in a corner, untouched for years, but still maintained with her characteristic neatness. He found the metal box nestled at the bottom, beneath old stethoscopes and outdated medical texts. It was a small safe, no larger than a hardcover book. He entered his birthday into the combination lock, 2-14-48, and heard the satisfying click as the mechanism released. Inside lay a collection of items he had never seen. A tarnished set of dog tags, a faded photograph of medical personnel posing before a field hospital, a Purple Heart medal still in its presentation case, despite what Susan had said about Margaret refusing it, and a sealed envelope with William written on it in Margaret's neat block handwriting. With trembling fingers, he opened the envelope. Inside was a letter dated 10 years earlier. "My dearest William," it began. "If you're reading this, it means I've either finally found the courage to share this with you, or I'm gone, and you found my hiding place. Either way, it's time you knew the full truth about what happened in Iraq, and why I've kept it hidden all these years." William's hands trembled as he continued reading Margaret's letter, the single bulb in the attic casting long shadows across the page. It wasn't just a bullet fragment, Bill. It was evidence. In April 2003, our forward surgical team was operating near Basra when we received word that a village had been accidentally hit during an airstrike. Our orders were to provide emergency care to the civilians. What we found was a massacre, not from an airstrike but from close-range weapons. Women, children, elderly men, executed. Captain Harris claimed insurgents had been hiding among the villagers and things escalated. But there were no weapons, no enemy combatants. As we tried to help the few survivors, I heard more gunshots. I ran toward the sound and found Harris shooting the wounded. I tackled him, his weapon discharged, and I felt the bullet tear into my back. In the struggle, I managed to subdue him, but not before he'd killed 3 more civilians. The official report stated that we were ambushed by insurgents, that Harris was killed by enemy fire while heroically treating civilians, and that I was wounded in the same engagement. It was a lie, Bill. Harris survived. He was quietly transferred out and eventually discharged with honors. The bullet in my back was American, not Iraqi. 3 other members of my team knew the truth: Susan Williams, David Johnson, and Maria Perez. We made a pact to never speak of it. The military had its narrative, and contradicting it would have meant court-martials, possibly prison. We were just trying to survive, to make it home. The Bronze Star they gave me is a fraud. I couldn't bear to wear it. Couldn't stand the thought of being honored for an act that, while it saved innocent lives, also covered up a terrible truth. So I buried it away along with the memories. I've lived with this secret for so long that it became part of me. Like that bullet fragment, something foreign embedded so deeply it couldn't be removed without causing damage. I wanted to tell you so many times, especially when we'd hear about war crimes on the news and you'd say, "How could anyone do such things?" I wanted you to know that sometimes the hardest courage is standing against your own. I'm sorry for not trusting you with this truth. It wasn't that I didn't trust your love. I didn't trust myself to face what happened if I spoke it aloud. Some wounds never truly heal. They just get walled off by scar tissue in time. Whatever happens, know that loving you has been the great redemption of my life. You gave me the chance to be a better person than the one who came back from that war. Always yours, Margaret. William pressed the letter to his chest, tears streaming down his face as decades of his wife's silent burden became clear. The stoicism, the nightmares she'd never explained, her reluctance to discuss her service, all of it crystallized into a single heartbreaking picture of a woman carrying not just shrapnel but guilt and trauma embedded as deeply as the metal in her flesh. Dawn was breaking as William returned to the hospital, Margaret's letter folded carefully in his pocket. The ICU was quiet except for the steady beeping of monitors and the soft shuffle of nurses changing shifts. Margaret remained unconscious, her condition unchanged through the night. Emily met him in the hallway, her face drawn from a night spent dozing in a hospital chair. "Any change?" he asked. She shook her head. "Stable but critical. They're increasing her antibiotics because the cultures came back showing an unusual resistant pattern." William nodded, the weight of Margaret's letter heavy in his pocket. He wanted to share it with Emily, to help her understand her mother's lifelong reticence. But something held him back. And this was Margaret's truth to share, when she recovered. Dr. Bennett approached them, clipboard in hand. "We're seeing some concerning trends in Margaret's blood work," he said without preamble. "The infection is triggering a systemic inflammatory response. We're going to try a more aggressive approach with immunomodulating drugs." Emily's physician's mind engaged immediately. "Are you thinking cytokine storm? That's rare with localized infections." "This isn't a typical infection," Dr. Bennett replied. "It's behaving more like a rejection response, as if her body is fighting against its own tissues now that the foreign body has been removed." "Like withdrawal," William murmured, remembering Dr. West's earlier comment about the growth utilizing the metal as a framework. Both doctors looked at him with surprise. "That's an interesting way to frame it," Dr. Bennett said slowly. "Her immune system essentially created a symbiotic relationship with this foreign body over years. Now that relationship has been disrupted." "Can you put it back?" William asked desperately. "The bullet fragment, if that's what her body needs." Dr. Bennett shook his head. "It's not that simple. The fragment itself likely contained toxic elements that would eventually have caused other problems, and the growth we removed had begun to develop abnormal characteristics that could have become malignant." "So what do we do?" William's voice cracked with strain. "We support her through this transition," Emily said, reaching for her father's hand. "Her body has to learn a new normal." The hours blurred into days as Margaret fought for her life. William maintained his vigil, leaving only when the nurses insisted he go home to shower and change. Emily divided her time between the hospital and making urgent calls to colleagues at major medical centers, seeking any insight into her mother's unusual condition. On the third night, Margaret's vital signs began to deteriorate. Her oxygen levels dropped despite the ventilator's support, and her blood pressure required medication to maintain. The doctor spoke in hushed tones of septic shock and multi-system organ failure. William refused to leave her side, holding her hand as monitors beeped warnings and nurses moved with increasing urgency around them. "Fight, Margaret," he whispered fiercely. "You're the strongest person I know. You survived war. You survived carrying this burden for 15 years. You can survive this." Sometime past midnight, Dr. West found William dozing in the chair beside Margaret's bed, his head resting against her hand. She touched his shoulder gently. "Mr. Harrison, I need to speak with you and Emily." The gravity in her voice jolted him fully awake. "What is it?" "Let's step into the family room." Emily was already waiting there, her face pale with exhaustion and fear. Dr. West closed the door behind them, her professional demeanor unable to mask her concern. "Margaret's condition is deteriorating despite our most aggressive interventions," she said quietly. "The infection has triggered a cascade of inflammatory responses that's affecting multiple organ systems. We're doing everything medically possible, but you should prepare yourselves for the possibility that she may not recover." The words hit William like a physical blow. "No," he said, shaking his head. "That's not acceptable. There has to be something else you can try." "Dad," Emily said gently, tears streaming down her face. "I've consulted with specialists at Mayo and Johns Hopkins. This is beyond standard medical protocols." "Then try non-standard ones." William's voice rose with desperation. "Experimental treatments, alternative approaches, anything." Dr. West exchanged glances with Emily before speaking carefully. "There is one approach we're considering, but it's highly experimental. We've been analyzing the tissue from the growth and have identified some unique properties in how it interfaced with the foreign body. If we could somehow replicate that interface artificially—" "Do it," William interrupted. "Whatever it is, do it." "It's not that simple," Dr. West cautioned. "The approach carries significant risks, and we don't have FDA approval for this specific application." "What's the alternative?" William asked, his voice breaking. "Watching her die. She survived a bullet in combat. She doesn't deserve to die from removing it 15 years later." In that moment of raw emotion, William pulled Margaret's letter from his pocket. "There's something you both need to understand about that bullet fragment. It wasn't just a combat injury. It was evidence of a war crime that Margaret helped prevent, that she's been carrying the guilt of hiding all these years." As William shared the contents of Margaret's letter, Emily's tears flowed freely, and even Dr. West's professional composure cracked. The truth of Margaret's burden cast her current struggle in a new, heartbreaking light, a woman who had risked everything to save innocent lives, only to be poisoned slowly by both the physical and emotional remnants of that heroic act. When he finished, a heavy silence filled the room, broken only by the distant beeping of monitors from the ICU. "We'll try the experimental approach," Dr. West said finally, her voice thick with emotion. "I'll take full responsibility. Your mother deserves every chance we can give her." As they returned to the ICU, the night nurse rushed toward them. "Dr. West, Mrs. Harrison's pressure is dropping critically. We need you now." They hurried into the room to find an alarming scene. Margaret's monitors flashing warning signals, her body shaking with fever despite the cooling blankets. The medical team moved with urgent efficiency, administering medications, adjusting ventilator settings, fighting to stabilize a woman whose body seemed determined to surrender. William stood frozen in the doorway, watching the battle for his wife's life unfold before him. In that moment, he felt utterly helpless. All his love, all his newfound understanding of her sacrifices, powerless against the biological storm raging within her. Emily gripped his arm, her medical knowledge unable to shield her from the raw emotional impact of seeing her mother so vulnerable. "Dad," she whispered, "what if we lose her?" William pulled his daughter close, allowing her to bury her face against his shoulder as she had done as a child during thunderstorms. "We won't," he said, with a conviction he didn't entirely feel. "Your mother is too stubborn to give up now." But as alarms continued to sound and the medical team's expressions grew increasingly grim, William felt his certainty waver. The weight of decades of unshared truths, of parallel lives lived side by side but never fully merged, pressed down on him with crushing force. Had they wasted too many years in protective silence? Would Margaret slip away before he could tell her that he understood, that her secret was safe with him, that her courage made him love her even more? The possibility was unbearable. In the harsh fluorescent light of the ICU, surrounded by the clinical trappings of critical care, William Harrison faced the starkest truth of all. Sometimes love isn't enough to save the people we hold most dear. Sometimes all the unspoken words and delayed honesty exact a price too steep to overcome. As Margaret's heartbeat faltered on the monitor, William whispered the words he should have said years ago. "I see you, Margaret. All of you, and I'm not afraid of your truth." For 72 hours, Margaret Harrison hovered between life and death. The experimental treatment Dr. West had implemented, an innovative approach using synthesized components from the removed growth tissue, showed neither clear success nor failure. Margaret's vital signs would stabilize for hours, offering tentative hope, only to deteriorate again, plunging her family into renewed despair. William maintained his vigil, leaving Margaret's side only when forced to by the medical staff. He slept in short, fitful bursts in the uncomfortable chair beside her bed, waking at every change in the rhythm of the monitors or movement from the nurses. Emily divided her time between supporting her father and conferring with the medical team, her professional knowledge both a blessing and a curse, as she understood all too well the gravity of her mother's condition. On the morning of the fourth day, William woke to an unusual sound, or rather, the absence of a sound. The ventilator's rhythmic whooshing had stopped. He jerked upright in panic, only to find Dr. West standing beside Margaret's bed, her expression cautiously optimistic. "Her oxygen levels improved overnight," Dr. West explained quietly. "We've reduced the ventilator support to see if she can maintain breathing on her own." William watched Margaret's chest rise and fall in a more natural rhythm. Is she improving?" "We're seeing promising signs," Dr. West confirmed. "The experimental treatment appears to be helping modulate her immune response. Her fever has decreased, and the latest blood work shows a reduction in inflammatory markers." Hope, that most fragile of emotions after days of crushing fear, flickered in William's chest. "So she might recover?" "I believe so," Dr. West said, tempering her optimism with professional caution. "She's not out of danger yet, but she's fighting back. The next 24 hours will be telling." Throughout that day, Margaret's condition continued to stabilize. By evening, she was breathing entirely on her own, the ventilator removed but supplemental oxygen still in place. The angry redness around her surgical site had begun to fade, and her fever had broken completely. Just before midnight, as William dozed in his customary chair, a soft pressure on his hand woke him. He opened his eyes to find Margaret watching him, her gaze clear and alert for the first time in days. "Bill," she whispered, her voice hoarse from the ventilator tube. "Margaret!" He leaned forward, cradling her hand between both of his. "You're awake." "How long?" she asked, each word an effort. "4 days. You've been very sick." She nodded slightly, grimacing at the movement. "Found my box?" William's throat tightened. "Yes. I read your letter." Margaret's eyes filled with tears that spilled silently down her temples. William wiped them away with his thumb. "You have nothing to be ashamed of," he whispered fiercely. "What you did that day saved lives." She shook her head slightly. "Should have told you. Years ago." "We both kept our wars to ourselves," William admitted. "I never told you about my time as a combat photographer, about the things I saw and documented. We've both been carrying secrets." Margaret's fingers tightened weakly around his. "Why do we hide the best parts of ourselves, the parts that matter most?" The question hung in the air between them, profound in its simplicity. Why, indeed, had they spent decades sheltering each other from the very experiences that had shaped them, that had forged their capacity for compassion and resilience? "Fear, I suppose," William answered finally. "Fear that the person we love might see us differently if they knew our whole truth." "Stupid," Margaret whispered, a ghost of her familiar directness showing through her weakness. William smiled through his tears. "Very stupid, and we're supposed to be the smart ones." Margaret drifted back to sleep, her hand still nestled in William's, but this time her rest seemed peaceful rather than the heavy sedation of critical illness. William allowed himself to truly relax for the first time in days, his body slumping with exhaustion in the uncomfortable chair. Emily found him there an hour later when she returned from grabbing a quick dinner at the hospital cafeteria. "Dad," she said softly, touching his shoulder. "Any change?" William nodded, hope evident in his exhausted face. She woke up, just briefly, but she was lucid. She knew me. Emily's professional reserve cracked, and she sank into the chair beside him. "Oh, thank God," she whispered, tears of relief filling her eyes. The latest labs were encouraging, but seeing her actually conscious— "Dr. West says she's not out of danger yet," William cautioned. "No, but waking up and being oriented is a very good sign." Emily squeezed her father's hand. "Mom's one of the strongest people I know. If anyone can pull through this, she can." Over the next 3 days, Margaret's improvement continued steadily. She began taking small sips of water, then progressed to clear liquids. The surgical wound, cleaned and redressed during her crisis, now showed healthy healing. Her periods of wakefulness grew longer, and though she tired easily, her mind remained sharp. Dr. West and Dr. Bennett monitored her progress closely, their professional caution gradually giving way to genuine optimism. The experimental treatment had been discontinued once Margaret stabilized, but blood samples were still being taken daily to track her immune response. On the afternoon of the 7th day, Dr. West requested a meeting with all 3 Harrisons. Margaret, now sitting up in bed and managing small amounts of solid food, insisted on participating despite William's concerns about her stamina. "I'm tired of being talked about instead of talked to," she declared with a flash of her old spirit. "If this is about my condition, I want to hear it firsthand." Dr. West arrived with a tablet computer and several folders of printouts. Dr. Bennett joined them, along with a third doctor Margaret didn't recognize, a tall woman with steel-gray hair and an air of authority. "This is Dr. Eleanor Blackwood from Walter Reed," Dr. West introduced her. "She's a specialist in immunology and has been consulting on your case." Dr. Blackwood nodded politely. "Mrs. Harrison, it's good to see you recovering. Your case has presented some fascinating immunological questions." Margaret's eyebrow raised slightly. "Glad my near-death experience could advance medical science." The dry comment, so characteristic of Margaret's humor, brought smiles to everyone's faces. The tension in the room eased perceptibly. "We've completed our analysis of the growth we removed," Dr. West began, opening one of the folders. "And I have to say, the findings are remarkable." She laid out several microscopic images on Margaret's bed tray. "What your body created around that bullet fragment wasn't simply scar tissue or a tumor. It was a highly specialized encapsulation structure that appears to have been serving multiple functions." Dr. Blackwood leaned forward. "Mrs. Harrison, are you familiar with the concept of biomineralization?" Margaret nodded. "It's how the body creates hard structures like bone or teeth. Calcium deposits, essentially." "Exactly," Dr. Blackwood confirmed. "What we found in your tissue sample suggests your body created a unique form of biomineralized structure around the foreign object. Instead of simply walling it off, which is the typical immune response, your body essentially incorporated it." "Incorporated it how?" Emily asked. Dr. Bennett joined the explanation. "The bullet fragment was slowly leaching metal compounds, lead, copper, antimony, substances that are typically toxic to human tissue. But instead of causing poisoning, your mother's body developed a mechanism to contain and process these compounds. The structure around the fragment had specialized cells that were binding to the metal ions," Dr. West added. "Almost as if your body had created its own detoxification system." Margaret frowned. If it was working so well, why did it suddenly become symptomatic? And why did removing it nearly kill me? The doctors exchanged glances before Dr. Blackwood answered. "We believe your body had reached a state of equilibrium with the foreign object. The encapsulation structure was managing the toxicity, but over time it required more resources to maintain this balance. That's why it developed its own blood supply and began to expand. And when we removed both the structure and the fragment, Dr. West continued. We disrupted this equilibrium abruptly. Your body had become dependent on the very thing it was fighting against. Like an addiction, William murmured. Dr. Blackwood nodded. A biological dependence, yes. The post-surgical crisis was essentially a withdrawal reaction on a cellular level. Margaret absorbed this information with the analytical mind of a surgeon. And this experimental treatment you used, what was that exactly? Dr. West looked slightly uncomfortable. We synthesized compounds similar to those your body had been processing from the bullet fragment and administered them in controlled doses, gradually tapering off as your system adjusted to their absence. You gave me bullet toxins as medicine? Margaret's tone was incredulous. In the simplest terms, yes, Dr. Bennett confirmed, though highly purified and carefully dosed. It was experimental, but given the circumstances, it saved my life, Margaret finished softly. She reached for William's hand. Thank you for authorizing that. I know it couldn't have been an easy decision. There was no decision to make, William said firmly. We were going to try everything possible. Dr. Blackwood cleared her throat. Mrs. Harrison, your case has significant implications for understanding how the body responds to long-term exposure to foreign materials, particularly in military veterans. With your permission, we'd like to include your anonymized data in a research study we're conducting. Margaret nodded without hesitation. Of course, if my bizarre immune system can help other veterans, I'm all for it. There's one more thing, Dr. West said, her expression shifting to something more personal than professional. When we analyzed the bullet fragment itself, we found something unusual about its composition and trajectory. She pulled out another folder, this one containing analysis of the metal object. This wasn't standard military ammunition. The composition matches specialized rounds used by certain units during that period of the Iraq conflict. Margaret's face paled slightly. You can tell that from the fragment? The metallurgical analysis is quite specific, Dr. West confirmed. And the entry angle based on the scar tissue formation is consistent with a close-range discharge during a physical struggle, exactly as described in your letter. The room fell silent as the implications of this statement settled over them. Dr. West had just confirmed, through physical evidence, the truth of Margaret's account of what happened that day in Iraq. How do you know about my letter? Margaret asked quietly. William squeezed her hand. I shared it with them when we thought we might lose you. They needed to understand the significance of what you'd been carrying. Margaret closed her eyes briefly, absorbing this revelation. When she opened them again, they held a mixture of vulnerability and relief. So now everyone knows. Only those of us in this room, Dr. Blackwood assured her. And speaking as someone who's worked extensively with veterans, Mrs. Harrison, what you did that day was an act of extraordinary courage. You prevented further atrocities at great personal risk. But I never reported it officially, Margaret said, the guilt that had burdened her for 15 years evident in her voice. I let them cover it up. You were a young doctor in a war zone, Emily said, speaking for the first time since the medical explanation began. You made the choice you thought you could live with. And then you did live with it, carrying both the physical and emotional weight all these years. Dr. Blackwood nodded in agreement. Mrs. Harrison, I've worked with many veterans who faced impossible moral choices in combat situations. The fact that this has troubled you for so long speaks to your integrity, not any failure on your part. Margaret looked at each person in the room, seeming to gauge the sincerity of their acceptance. Finally, her gaze settled on William. What do you think, Bill, now that you know everything? William didn't hesitate. I think I'm more proud to be your husband than I've ever been, and I think it's time we both stopped hiding our war stories from each other. A single tear slipped down Margaret's cheek. 46 years of marriage, and we're just getting started on the real conversations? Better late than never, William said, lifting her hand to his lips. Dr. West cleared her throat, visibly moved by the exchange. On a medical note, Mrs. Harrison, your recovery is progressing remarkably well. If this continues, we should be able to discharge you in another few days. You'll need follow-up appointments, of course, and we'll want to monitor your immune function for several months. As the doctors finished their explanations and prepared to leave, Dr. Blackwood paused at the door. Mrs. Harrison, the Department of Veterans Affairs has been notified about your case purely from a medical perspective at this point. But given what we now know about the circumstances of your injury, you might consider filing for a service-connected disability claim. The evidence would support it. After the doctors left, the Harrison family sat in thoughtful silence. The medical explanation, while fascinating, was less significant than the emotional breakthrough they had just experienced. Decades of carefully maintained barriers had finally fallen away, leaving them exposed, but somehow lighter. "So," Emily said eventually, "a combat photographer and a war-zone surgeon. My parents have been secret badasses all this time, and I never knew." Margaret laughed softly, then winced as the movement pulled at her healing wound. "I wouldn't go that far." "I would," William said firmly. "What you did in Iraq, Margaret, standing up to that captain, protecting those civilians, that was heroic by any measure." "And what about you?" Margaret asked. "All those years documenting the war, bearing witness to things most people couldn't face, that took its own kind of courage." Emily looked between her parents with new understanding. "No wonder I ended up in emergency medicine. I've been trying to live up to examples I didn't even know I had." Margaret reached for her daughter's hand. "I'm sorry we kept so much from you, Emily. We thought we were protecting you, but maybe we were just protecting ourselves." "From what?" Emily asked gently. "From having to relive it," William answered. "From having to explain the parts of ourselves we weren't sure we understood or accepted." "But now?" Margaret looked at him questioningly. William smiled, the lines around his eyes deepening with genuine happiness despite his exhaustion. "Now we have nothing left to hide. And it turns out the truth, however difficult, feels a lot lighter than all those secrets we've been carrying." Margaret nodded, settling back against her pillows as fatigue began to claim her. "Bill," she murmured as her eyes drifted closed, "when I get home, I want to see your photographs. All of them. It's time I knew the man I married. Completely." "It's a date," William promised, watching as his wife slipped into a healing sleep, her face more peaceful than he had seen it in years. Outside in the hallway, Emily hugged her father tightly. "She's really going to be okay, isn't she? Not just physically, but all of it." William nodded, his own eyes moist with emotion. "I think we all are, finally. Sometimes it takes nearly losing everything to find what was missing all along." "Truth," Emily said simply. "Truth," William agreed, "and the courage to share it however late in the game." 6 months later, Margaret Harrison sat on her front porch watching the late June sunlight filter through the maple leaves. Her recovery had been slow but steady. 2 weeks in the hospital, another month of home visits from nurses, and then the gradual return to something resembling normal life. The surgical scar on her back had healed into a puckered reminder, no longer painful, but impossible to forget. William emerged from the house carrying 2 glasses of iced tea, the lemon slices bobbing among the ice cubes. He handed one to Margaret and settled into the wicker chair beside her, their evening ritual since the weather had turned warm. "Emily called," he said, taking a sip from his glass. "She's presenting the case study next week at the medical conference in Chicago. Says there's been enormous interest from veterans' health researchers." Margaret nodded, a hint of pride crossing her weathered face. Still seems strange having doctors all excited about something that tried to kill me. Something that protected you for 15 years, then tried to kill you, William corrected gently. That's what makes it so remarkable. Indeed, Margaret's case had become something of a medical sensation in certain circles. The way her body had constructed an elaborate biological filtration system around the foreign object was being studied as a potential key to understanding long-term responses to embedded shrapnel. Knowledge that could help thousands of veterans who, like Margaret, carried pieces of war within their bodies. Susan called too, William continued. Says the VA finally approved her disability claim. Your testimony made the difference. Margaret smiled, genuine pleasure lightening her features. About time they recognized what those oil fires did to her lungs. Only took 20 years. The months of recovery had transformed more than just Margaret's physical health. After William had shared his combat photography, with its raw documentation of Vietnam's horrors, and Margaret had elaborated on her experiences in Iraq, something had unlocked between them. Conversations that had been impossible for decades now flowed easily, the shared understanding of what they had both witnessed creating a deeper connection than either had thought possible after so many years. Margaret had made two difficult but liberating decisions during her convalescence. First, she had contacted a military historian specializing in Iraq war testimony, recording her account of what had happened in that village near Basra. Without naming the other medical personnel involved, she had finally spoken her truth, contributing to the complex historical record of a conflict whose full reality was still emerging decades later. Her second decision had been harder, reaching out to Emily with the complete story, including both the physical and moral wounds she had carried throughout her daughter's childhood. Their relationship, always loving but sometimes distant, had deepened through Margaret's vulnerability and Emily's compassionate understanding. "I've been thinking," Margaret said now, looking out over their modest front yard where daylilies nodded in the gentle breeze, "about that trip we always talked about." William raised an eyebrow. "Which one? We've talked about a lot of trips we never took." "The big one. Iraq." William's hand stilled, his glass halfway to his lips. "You're serious?" Margaret nodded, her expression contemplative. Susan found this Veterans Reconciliation Program. American vets returning to meet with Iraqi veterans, visit sites, even participate in community projects. She's thinking of going in October. "And you want to join her?" "I think," Margaret paused, searching for words, "I think maybe it's time to see it through different eyes. Not as a terrified military doctor, but as an old woman who's had a good life despite what happened there." She turned to face him directly. "But I'd only go if you came too. Maybe afterward, we could visit Vietnam as well, to see the places you were, to close that circle together." William reached for her hand, their fingers intertwining with the easy familiarity of decades. "I never thought I'd want to go back to Vietnam. But now, with you, yes, I think it might be healing for both of us." They sat in comfortable silence as the evening shadows lengthened across the lawn. So much had changed since that January day when William had noticed the changing mole on Margaret's back. What had begun as a medical crisis had transformed into a journey of truth-telling and reconciliation neither had anticipated. The ringing phone interrupted their contemplation. Margaret went inside to answer it, returning moments later with a puzzled expression. "That was Dr. West," she said. "She wants to meet with us tomorrow. Says there's something important she needs to discuss about my case." William frowned. "Did she say what? Your last checkup was fine." "She didn't give details, just said it wasn't urgent, but it was significant." Margaret sat back down, concern creasing her brow. "Said it has to do with the final analysis of the tissue they removed." The following morning found them once again in Dr. West's office, though the circumstances were far less dire than their previous visits. The young doctor greeted them warmly, her professional manner tempered with the genuine affection that had developed through Margaret's treatment. "Thank you for coming in," she began, gesturing them to comfortable chairs. "First, let me assure you that this isn't about any health concern. Margaret's recovery continues to progress excellently." "Then what's this about, Doc?" Margaret asked, her natural directness undiminished by her medical ordeal. Dr. West opened a folder on her desk. "As you know, we've been conducting extensive analysis on the tissue removed from your back, as well as the bullet fragment itself. The findings have been remarkable from a medical perspective, offering insights into how the body responds to long-term foreign bodies." She paused, choosing her words carefully. "What I need to discuss with you today is something unexpected that emerged in the final metallurgical analysis of the bullet fragment." Margaret felt William tense beside her. "What about it?" she asked. "The bullet wasn't standard military issue, not American, not Iraqi," Dr. West said. "The composition is consistent with custom-loaded ammunition popular among certain private security contractors during that period." Margaret's face remained impassive, but William felt her hand seek his beneath the edge of the desk. "Additionally," Dr. West continued, "the trajectory analysis based on the tissue structure suggests the bullet entered at an unusual angle, inconsistent with traditional combat firing positions." "What are you saying exactly?" William asked, though he suspected he already knew. Dr. West met their gaze directly. "I'm saying that the physical evidence doesn't align with a standard combat injury. It's more consistent with a close-range discharge during a struggle, exactly as described in Margaret's account of her confrontation with Captain Harris." Margaret exhaled slowly. "Why are you telling us this?" "Because this physical evidence corroborates your testimony," Dr. West explained. "The Department of Veterans Affairs has requested these findings as part of their review of similar incidents. With your permission, I would provide them with the technical analysis without any personal identification." Margaret was silent for a long moment, her expression unreadable. Finally, she asked, "There were others? Other incidents like what happened in that village?" Dr. West nodded solemnly. "Unfortunately, yes. Your testimony, along with this physical evidence, helps establish a pattern that officials are now acknowledging decades later." The implications hung in the air between them. After nearly 20 years, the truth Margaret had carried within her body was finally emerging, not just as her personal burden, but as part of a larger historical reckoning. "Will this help other veterans?" Margaret asked simply. "Potentially, yes, both medically and in terms of validating experiences that were officially denied or covered up." Margaret nodded decisively. "Then you have my permission. Use whatever you need from my case." After leaving the hospital, Margaret was unusually quiet during the drive home, staring out the passenger window at the summer landscape flashing by. William gave her the space to process, understanding that some revelations required silence before words could form around them. It wasn't until they were back home, sitting at their kitchen table with mugs of coffee between them, that Margaret finally spoke. "All these years," she said softly, "I thought I was protecting myself by keeping silent. Turns out, I might have been protecting the wrong people." William reached across the table to take her hand. "You did what you thought was right at the time, Margaret. We all did. But if I'd spoken up sooner, maybe other veterans wouldn't have carried their secrets alone for so long." Her eyes, faded blue but still sharp, met his. "Maybe you and I wouldn't have had those walls between us all those years." "We can't change the past," William said gently. "But look at what's happening now because you finally told your truth. That counts for something important." Margaret nodded slowly. "It's strange, isn't it? That bullet was killing me inch by inch for decades, but in the end, It might help heal others. A hint of her wry smile touched her lips. Sounds like one of those sermon metaphors Pastor Jim is so fond of. William smiled. He'd certainly make a Sunday message out of it if he knew the whole story. Their conversation was interrupted by the arrival of Emily, who had driven in from Chicago for the weekend. Since Margaret's hospitalization, these visits had become more frequent and more meaningful, the superficial family dynamics replaced by deeper connections. "So, what did Dr. West want?" Emily asked, after settling in, her clinical curiosity evident. Margaret explained the situation, her voice steady as she outlined the technical confirmation of her long-held secret. Emily listened with both professional interest and daughterly concern. "Mom," she said when Margaret had finished, "have you considered talking to a PTSD specialist? The VA has some excellent programs specifically for Iraq War veterans." Margaret's initial instinct to dismiss the suggestion was visible on her face, but after a moment's reflection, she surprised both William and Emily by nodding thoughtfully. "Might not be the worst idea," she conceded. "Susan's been going to a group at the VA hospital in Grand Rapids, says it helps, talking to other folks who were there." "It helped me," William added quietly. "After your mother got sick, I started attending a support group for Vietnam veterans." Just being able to speak about those experiences after keeping them buried for so long, it was like finally being able to breathe fully. Later that evening, as Emily helped William prepare dinner, she marveled at the change in her parents. "I feel like I'm getting to know you both for the first time," she admitted, chopping vegetables at the counter. "All those years I knew something was locked away, but I never understood what." William smiled sadly. "We thought we were protecting you by not burdening you with our ghosts." "But they shaped our family anyway," Emily observed. "The silences, Mom's nightmares, your career change that I never knew about until now." She paused, knife suspended over a half-cut carrot. "I keep thinking about all my patients over the years. How many of them might be carrying similar secrets, physical or emotional wounds they never reveal." "That awareness will make you an even better doctor," William said, squeezing his daughter's shoulder. Through the kitchen window they could see Margaret on the porch, deep in conversation with Susan Williams, who had stopped by unannounced, something that had been happening more frequently since Margaret's recovery. The two old soldiers sat with heads bent together, occasionally gesturing as they spoke, their postures more relaxed than William could remember seeing in all the decades of their friendship. "They're planning the Iraq trip," Emily said, following her father's gaze. "Mom called me last night to ask about vaccinations and health precautions." William nodded. "I think it's important for her. For both of us, really." "Are you nervous about going back?" William considered the question seriously. "Not nervous exactly, but I wonder how it will feel to see those places again, if they'll even be recognizable after so many years." He smiled reflectively. "The last time I was in Vietnam, I was young and traumatized and desperate to escape. Now I'll be returning as an old man with perspective and hopefully some wisdom." "And with Mom," Emily added. "That makes all the difference, doesn't it?" "It does," William agreed, watching his wife through the window. "We missed the chance to share those experiences when they were happening. But now, somehow, we've been given another opportunity to face them together." On the porch, Margaret looked up and caught William watching her. She smiled, a genuine, unguarded smile that reached her eyes and erased decades of careful self-containment. In that moment, William saw not just the woman he had married, but the whole of her. The young doctor, the wounded veteran, the wife who had kept parts of herself hidden, and now this newest version, a woman finally at peace with her complete story. The bullet that had lived within her for nearly 2 decades was gone, but what remained was something more valuable, the truth it had carried, finally exposed to the healing light of day. 3 months later, Margaret and William stood together under the desert sun, their hands clasped tightly as they gazed across the landscape outside Basra. The Veterans Reconciliation Program had brought them to this spot, not far from where Margaret had received her wound all those years ago. The landscape had changed dramatically. New buildings stood where destruction had once reigned, and children played in streets that had once been combat zones. An Iraqi veteran who had fought on the opposite side now stood beside them as a guide and newfound friend, a living testament to how time could transform even the deepest divisions. "It looks so ordinary," Margaret whispered, the wind carrying her words across the desert sand. "Hard to believe so much happened here." William squeezed her hand. "That's how it was in Vietnam, too. The land heals faster than the people." Their guide, Farid, nodded in understanding, though he hadn't heard their quiet exchange. He had his own memories of this conflict, his own wounds both visible and hidden. Through translators and the universal language of shared experience, he and Margaret had found common ground despite having once been enemies. That evening, back in their modest hotel, Margaret sat on the edge of the bed, methodically writing in the journal she had kept throughout their journey. William watched her from the small chair by the window, struck by how much younger she looked in this setting, as if returning to the landscape of her trauma had somehow allowed her to release some of the weight she had carried away from it. "Tomorrow we visit the hospital where you worked?" he asked. Margaret nodded, not looking up from her writing. "What's left of it? Most of the original building was destroyed in later fighting, but they've rebuilt. Some of the Iraqi doctors I worked alongside are still practicing there. Are you nervous about seeing them?" Now she did look up, considering the question seriously. "Not nervous. Grateful, I think. Grateful that we all survived long enough to see this day." She set her journal aside. "And after that, we go to Vietnam?" "If you're still up for it," William confirmed. "My old unit area first. Then some time to just experience the country as it is now, not as it was during the war." Margaret moved to join him by the window, gazing out at the desert night. "Did you ever imagine all those years ago that we'd be doing this? Going back to face our wars together?" William shook his head. "I never imagined talking about Vietnam again, let alone returning there. And I certainly never imagined that a spider-like growth on my wife's back would be the catalyst for all of this." Margaret laughed softly, leaning against his shoulder. "Life takes strange turns. If you had told me during those dark days in the field hospital that someday I'd come back here voluntarily, with my teacher husband who turned out to be a combat photographer, I'd have said you were delirious from the heat. And yet, here we are," William murmured, wrapping his arm around her waist. "Here we are," Margaret agreed. "Older, scarred, but finally whole." As they stood together looking out at the land that had once been a battlefield, William reflected on the journey that had brought them to this moment. The mysterious growth that had nearly taken Margaret's life had instead given them both a second chance, not just at survival, but at truly knowing each other, at breaking down the walls built by decades of protective silence. Some might call it ironic that a bullet, an instrument of destruction, had ultimately led to healing. But William preferred to see it as redemptive, the final mission of two old soldiers who had found their way home at last, not just to each other, but to themselves. "Whatever happens from here," Margaret said softly, as if reading his thoughts, "we face it together. No more separate wars." "No more separate wars," William echoed, sealing the promise with a kiss to her temple. Outside, the desert wind carried away the last lingering ghosts of battles long past, leaving only the present moment, and the future still to be written, one honest word at a time. Margaret and William's story reminds us that it's never too late to heal old wounds and share our deepest truths. For nearly 50 years, they carried separate burdens from their wartime experiences, She with a bullet fragment physically embedded in her body, he with photographs he'd never shown anyone. It took a medical crisis at age 65 to finally bring their hidden pasts to light, allowing them to truly see each other completely for the first time. Their journey shows us that the secrets we think protect us often become the walls that separate us from those we love most. Whether you served in Vietnam or Iraq, lived through those turbulent times, or carry your own unspoken stories, remember that sharing your truth can be the most powerful medicine of all. The courage to be vulnerable, even after decades of silence, can open doors to deeper connection and unexpected healing. What secret have you kept that might actually strengthen your relationships if shared? Or when was a time that opening up about your past brought you closer to someone you love? Share your story in the comments. You never know who might need to hear exactly what you've experienced.